Hi, my name's Michelle Morris. I'm one of the clinical teaching fellows over here at NUH, and I teach the MBD, so musculoskeletal diseases and disorders. I want to talk to you about a near-peer clinical buddy scheme for final year medical students that we set up over here, which seems really pertinent given Janet's speech. This scheme was largely set up by myself and Dr. Nicholas Scott, who's now moved to Liverpool. We also had quite a lot of help from Rosie Arnott and Dr. Sama Moran, who helped us with the initial setup of the scheme. So I think it's really important that they're mentioned as well. So the background for this scheme is that we all are well aware that there's high rates of stress and poor mental health in medical students globally, and that stress, poor mental health is linked to poor academic performance. And a lot of studies show that the stress particularly persists throughout progression of the course. So even in fifth year, they're really stressed, and points of transition and examinations are particularly stressful. So this past year, we recognised that there was significant disruption for the medical students due to COVID. So changes to examinations, changes to course structure, clinical time, as well as just navigating the complexities of the clinical environment and the impacts of COVID-19. So we recognised at NUH that there was a need for enhanced support for these final year medical students. So what we decided, or what we know from the literature, there's quite a lot of strong evidence for mentoring in the industry, but in medicine it's relatively a recent phenomenon. But all the evidence shows that mentoring kind of provides personal growth and support, but also social support and networks, which is important in COVID, where a lot of this is lost. As Janet talks about, students are kind of at home learning now. So we thought mentoring would be a useful thing to provide for the students. So what we did at NUH is we had 115 students that were at NUH for all 4 of their CP3 attachments. And each of these students we paired with a pre-registrar level doctor, so from foundation year 1 to CT2 level doctors. We recruited these doctors, majority of them through junior doctor induction sessions, which I think Rachel just mentioned, or someone just mentioned. So the 4 of us went to each of the induction sessions and spoke to all the new doctors. We also sent around emails and newsletters, which weren't so successful, and we created a poster with a QR code for them to sign up, which a lesson learned wasn't particularly productive at all because only 1 person signed up that way. For each of the attachments, we had a link teaching fellow that either the students or the junior doctors could speak to, so either myself, Nikki, Rosie or Sam. And we provided a narrated PowerPoint for both the students and the doctors with information about the scheme, things that led to good mentoring. We gave them some kind of frameworks for almost like a contract between them, and also some feedback sessions that they could do. And at the end of the session, or end of the scheme, after their exams, we sent around online feedback forms either via Microsoft Teams, Microsoft Forms or Google Forms, to get feedback from them about the scheme. And as Rachel has discovered, what we did with the doctors is when they completed their feedback, it would auto-generate a certificate for them that they could use for their portfolio as evidence of mentoring. So if they completed their feedback, they got a certificate. Okay, so the results that we had, 36 responses from the junior doctors, which is a low from the students, which is a low response, but we know that's a problem. And we asked them lots of questions. I'll just show some of them. So we asked them how they felt about the scheme, and these are some of the quotes. So mostly they found it reassuring and also really useful for to find people. So almost that open door was available for them. It was kind of gave a sense of relief or appreciation that there was support for them. On average, they met with their doctor. So the majority of people met about 3 to 5 times, so almost once a month or once every couple of months. Some people a bit more, some people a bit less. And they met in a variety of environments, ward environments, like social environments like the restaurant and the coffee shop, virtually, but also face-to-face as well, which does show that students do want to physically meet with people. The things that they covered predominantly actually weren't teaching, more advice, so careers advice, examinations advice, and a lot of general wellbeing support. And actually, the other domain on that graph is also examination practice, because they said things like OSCE practice, things like that. In this graph, we asked them sort of which things they almost felt the buddy scheme helped with. And we divided this into 12 domains. So if the bars on this graph show more navy blue or this sort of royal blue, that shows that they found this more helpful. So the area actually they found it most helpful in was in the wellbeing domains. where the majority of students found it really helpful. I think it's probably worth noting that reflective practice skills, which is really important for self-regulation, wasn't really helped with this. And overall, nearly 80% of them found that it was really helpful in supporting them through their final year. Mostly they found it's an efficient way to practice examination and history taking and gain skills, but actually just having the support and sense of security and someone to talk to that's a near peer and not someone seen like a teaching fellow or someone at the uni was really helpful. They would like to improve the scheme by matching people with similar career interests, a bit more structure for the buddies, for the doctors, things that they could go through, despite us talking on the narrated PowerPoint at the beginning about these things. So that's what the students said. The doctors, obviously, some of the questions match about how often you met, but the things they got most out of it was improved teaching skills, improved communication skills, job satisfaction, which is really important, particularly in that COVID context. And again, lots of them had an increased interest in future student teaching roles. So that's a really good way to recruit people as well. In terms of sort of the burden on the department, because you always worry you set these schemes up, it's really time consuming, but actually only 12 of the doctors contacted the teaching fellows for support and only a few of the students as well. So once we'd set the scheme up, really it didn't need a lot of resource at all, it almost ran itself. And 88% of the doctors said they'd recommend to their peers that they got involved in a similar scheme as well. So they really enjoyed it. I think the social aspect comes across in how the doctors would like to improve the scheme and really organise group sessions for the mentors, for the doctors, so that they could learn from each other and share their experience. There were some logistic issues with environment or with location for some of the students as well. And generally, I think they really liked the scheme. It helped with their knowledge. So things that helped, as I said, 79% of the students rated it as helpful. Wellbeing was by far the strongest aspect of what they got from it, but also it helped with their knowledge and skills, a sense of belonging and that psychological safety, which we've talked about before, just that's so important for being in a position to learn and belonging on the wards. And I've already said the doctors kind of enjoyed improving their teaching skills, communication skills, job satisfaction, interest in teaching. It didn't really take a lot of resources. The limitations are that we only got 36 responses from students, so there is probably an element of response bias in it. We could consider the scheme again, but opt out for students that aren't going to participate, and Janet again alluded to that. Consider matching students to career interests, and logistically, the students aren't going to be at CP3 for NUH or the CP3 this year, so we need to consider how that would work in practice and maybe consider collecting outcome measures for either clinical improvement or wellbeing, for example. So whistle stop tour of our scheme. Thank you.